We are the show. So excited. Oh, we're live. Hi, good afternoon and happy Saturday. This is Adelita Grijalva, and we were doing these pláticas, just talking throughout the campaign on issues related to voting and voter registration and barriers that people see in voting. We talked about USPS. And so since we're transitioning into holding the office as a supervisor, and thank you all again for all of your support, we really wanted to continue these pláticas and talk about what the big issue is right now. And quite frankly, it's COVID-19 and our community and how it's affecting our community. I was on a call the other day with some people from the TMC, Banner, Pima County Health Department, and the rates of positivity are essentially 1 in 4. So of the 4 tests that are being taken, 1 person is positive, and a lot of people don't even realize that they have it. And so I think that it's important for us to have a conversation, continue to talk about it, because as much as, you know, the Pima County Health Department has their has all of their press conferences, that kind of thing. And thank you, Dr. Cullen, for joining us. I was just talking about you. You know, we want as a community to continue to provide opportunities for people to access information. And so joining me today, I'm so very thankful, is Dr. Cullen from the Pima County Health Department and Gloria Hamlets, longtime director of the John Valenzuela Youth Center. And I feel like we've been doing the same kind of work for over 20 years. So I'm very appreciative. I'm going to introduce a little bit about each of you specifically, because I think that it's important that people appreciate that you bring a lot of expertise to the situation. And what we really want to talk about is our healthcare system being under heavy stress and is near a breaking point. If we don't come together to stop the spread of COVID-19 in Pima County, the results will be detrimental to the fabric of our community. Our emergency departments and hospitals are full, and they're facing shortages of staff and critical supplies, and our hospitals are under great stress. And so joining me today is Gloria Hamlets Lopez. She's been a program director for the South Tucson John Valenzuela Youth Center for 20 years. She's developed the center's high quality standards of care and programs for young people, including my own children. She's opened her doors in the past year to fill the void when it comes to education in South Tucson by being a hub for a lot of community members. And thank you so much for that, Gloria. And she's a tireless advocate for young people and families in her community, and particularly the ones who have no other advocates. And then Dr. Teresa Cullen is the head of the Pima County Health Department, in addition to several other medical and public health roles, such as former Assistant U.S. Surgeon General. Dr. Cullen is retired from the U.S. Public Health Service and is also an admiral. So she could either be doctor or admiral, depending on what title we want to use. And she's a graduate of the University of Arizona College of Medicine, so she is a local from here. And we are really very appreciative of both of you and the time. And so I just wanted to ask Dr. Cullen, what is the state of COVID and the spread of COVID in our community, and what can our community members do to help curb the spread?
Okay, hopefully you can hear me.
Oop, I can't hear you very well. Maybe.
Better now?
A little bit, yeah. If you can talk louder, that probably will do it.
Okay, that's so currently COVID is in what we would call a state of accelerated transmission in the community. That's typical to a lot of communities right now in the United States, but you may be aware that as of yesterday, Arizona had the highest accelerated transmission in the country, very similar to what we had in June or July. So we track COVID through a couple different metrics. One metric is the number of cases we have per 100,000. You can estimate that the county has about 1 million people. Right now, we're over 500 cases per 100,000 per week. That's a weekly measure. We also look at positivity, which is the percentage of tests that are positive. You've heard lots of chatter about this. So, well, that reflects the number of tests. Actually, in our case, because the number of tests we have, if anything, is increasing when our positivity rate goes up, it means we have increased positivity, increased number of cases in the county, and that is what we are seeing with that. Our third disease metric that is actually in some ways the most concerning, because this has never hit red before, is what we call our COVID-like illness rate. That's the number of cases that are COVID or COVID-like based on what is presenting to our emergency room. That is 13% right now. Up till last week, we were always consistently less than 10%. We expect that rate will stay high. So that kind of gives you just an overall really quick look into what we're seeing. The cases are all over. It's a scattergram. There is not just one part of the community that is seeing accelerated transmission. So what that means is that we believe that the community itself, the entire county, has to be engaged in any what we call layered mitigation. Layered mitigation are the things we ask you to do to try to halt the disease. And let me just briefly talk about the hospital system. Yesterday, we did a press conference with some of the hospitals as well as pre-hospital. Those are your EMS and fire department and police department, anybody that's in the community, coupled with the public health department. And we did that because we released a letter. This letter was actually a plea. It was a plea to the community to ask them to cooperate with what we have recommended, and we can talk about that later. But the reason why we did that was because the hospitals are at capacity. Yesterday, our ICUs were at 98.5% capacity. There were less than 2 ICU beds at any one time. The medical surge beds were at about 97% capacity. You may be aware that other counties and other states have made decisions to do more stringent interventions when they have less than 15% capacity, and we have less than single digit capacity. With that, I'll stop because I can go on for a while.
Okay. Well, those are some very sobering numbers, and I know that it's pretty scary out there. And so, Gloria, I know that you mentioned before that you'd contracted COVID. Can you talk about if you know how you contracted it, because sometimes people don't know, and how what the experience was like having COVID, and then how are you feeling right now?
Sure. Well, first of all, I just want to say thank you for inviting me to the Pláticas, and thank you. I'm going to use admirable, Dr. Dolan, because we are grateful for your leadership in this county. You know, we've been working at our youth center since school ended. Once the governor shut down the schools, we clearly recognized the need for children to have a safe place to be during the day. So we opened our doors immediately. Because I work with a low-income population, I knew how vulnerable they were going to be should they ever get sick. So I devoured every piece of literature I could find on how to protect our children, how to protect ourselves, how to protect our community and our families. We built a really strong policy and procedure manual with our agency, and we just continue to do our best to keep everyone as safe as possible. When the mask mandate started for Pima County, we were happy to comply with that mask mandate to keep everyone safe as time continued. In about early June, we had one health scare. My husband had some congestion, but no other symptoms, no fever, nothing. In early June, the testing was still not readily available. He had to have a doctor's note to get tested, but as soon as he got tested, we all went on quarantine. Thankfully, he came out negative, and we were able to continue to go about our daily business. But for me, it was a big enough scare that I needed to continue to push more and more cleaning, more and more social distancing. We needed to make bigger impacts with our community. Because our center serves children all day, I also knew that we had a lot of parents that were out there working that were essential workers, and we had to do a lot of education for our families as well too. Personally, in about July, when the second spike hit, several of my family members in Phoenix were hit really hard with COVID, and unfortunately, one of my primos, my cousin, my compadre, Margarito Castro, he succumbed to his illness and passed away. And for us personally, that was really difficult. You know, we wanted to be there for our family. We wanted to be there to comfort them, and knowing how high the rates were, we couldn't do it. So emotionally, that became really difficult for us. In about August, my husband started again with some congestion. You know, I didn't think too much about it this time. I thought, oh, he had it before. it was negative. He didn't have fevers. Nobody was feeling bad. At our work site, our workloads had really increased to respond to the community. We started doing food boxes, and of course I was fatigued. I was really tired. My muscles hurt. I was sore, but I was attributing this to I'm lugging in thousands of pounds of food every day in the middle of summer with a mask, and I'm thinking, this is just summer fatigue. It's hot. I'm not young anymore. This is just, it's not COVID. But when my husband got the congestion, we said, you know what, we all need to get tested. So we quickly got tested. We went into isolation, and we were really surprised at how quick we got our results back and how my husband had tested positive. One thing that I didn't mention was that our workplace, we were testing regularly. Once testing became readily available, we were going almost every 2 weeks. Sometimes people felt that was really excessive, but for me, it wasn't just about, am I positive at this moment? It was also about, can we trace, where we got it from, when we think we contracted it, so that we could also notify everyone. Once I became positive as well, when we went into quarantine, our agency implemented all of their policies and procedures. We had our families tested, children tested, coworkers tested, and I can't reiterate enough how guilty I felt, knowing that I had been to work, that I could be the source of infecting children, vulnerable adults, knowing how many were being raised by grandparents, how many lived in multi-generational households. Given the population density of South Tucson, I knew it was a big deal. I tested positive. I was in this environment. Thankfully, everyone was able to get tested, and nobody else tested positive at our work site. And I attribute that solely to masks. Masks kept everybody protected in that environment. We followed those CDC guidelines, but it was ultimately the fact that we were masked up at all times, including our young children. I kept hearing from everyone, okay, you're positive now, prepare yourself. And I started to hear everyone say, it's the flu. It's going to be like the flu. You're going to be okay. And I had some frame of reference. I've had the flu before. I've survived it. I mentally prepared myself. I can do this. I can do the flu. And sure enough, every day we started a journal. My family and I, we would take our temperatures, write down our symptoms, write down what was going on, our oxygen levels, our blood pressure levels. And we were just reporting really mild symptoms. We had headaches, muscle aches, fatigue. By day 6, we were like, this is okay. I can do this. Maybe we've got it. But then day 7 hit, and we started to feel tightness in our chest. And that just started just this huge roller coaster of where my lungs specifically took a really brutal hit. It was really hard to keep breathing. My energy level was 0. I lost my sense of taste. It made it really hard to eat and drink because everything tasted gross. I couldn't put anything in my mouth, and I knew I needed the nutrients. And then it just spiraled from there. We continue to use telemed, to get over-the-counter medicine brought in, constantly calling the doctor, getting prescription, getting inhalers, getting several rounds of steroids, getting cough medicine, and we were still testing positive for the virus. Within about week 5, I think I finally tested negative, but by then I was still pretty tired. I was pretty fatigued. I definitely had developed asthma. I really struggled to breathe, to do smaller activities. In my household, I was the healthy one. My daughter had some issues with anemia, and she had to be hospitalized. My husband was a diabetic, had high blood pressure. He was the high risk category. And for some reason, I got the sickest. They see my daughter bounce back right away. She's young. She was pretty much healthy. She seemed to bounce back. My husband, he seemed to be okay. I seemed to be the one that took the longest time to recover. By week 6, I was ready to go back to work, or on paper I was physically. I did struggle. My feet were swollen. My whole body was swollen. I needed to sit down frequently. If I talked too much, if I talked too loud, which you have to do when you work with kids, I struggled. I struggled to catch my breath. Quite often, I would have to sit down. I'd have to take breaks. I'd have to use my inhaler several times throughout the day. But I started to feel maybe this is okay. I'm going to get better. I'm week 7. I'm going to get better. Week 8, my symptoms aren't improving very much. The coughs had gone away. And then by month 2,
Wow.
the second month after, I had contracted COVID, I started to develop other issues. I started to develop rashes throughout my body that were just so itchy, and I could not stop. I was prescribed topical creams, prescription creams, over-the-counter creams, and I couldn't quite get them away. The asthma still continues to plague me. The fatigue, the muscle aches, the joint aches are still there. The headaches are still there. And now I'm looking at month 4, and I'm thinking, gosh, when am I going to get better? And sure enough, month 4, now I'm looking at some issues related to my kidneys. My kidneys aren't functioning as properly as they should. So when we talk about this is just the flu, gosh, I really believe that. I really believe that people said that, and I believe the literature that said you're going to be done in a few weeks. And then I started looking online, and I started finding more support groups of people that were reporting these problems to their doctors and saying, oh, it's going to go away. Don't worry about it. Don't worry about it. You're going to get better. By the time I was done with treating my virus and trying to survive it, within that 1 month, I know I had spent about $500 on just doctor's visits, co-pays, medications, things that I needed at home, like a humidifier. And I also was really fortunate that I was working and that I had a lot of vacation time logged up that I was able to utilize so that I wasn't missing those paychecks either. And for me, I know I'm really lucky, and I don't want this to turn into a woe is me story, but I really recognize that privilege that I have. I am beyond privileged that I had a job, and that I had a job that provided insurance, and that good insurance, and that I was able to save money on a medical card to be able to access everything that I needed to treat myself. And that I still have a job. I have a job that I can sort of modify and slow down when I need to. And that I still have health insurance. And I think it's so important to recognize that, because I know so many families don't have that privilege. I know that they don't have those regular doctor visits, so they can't afford the $75 telemed visits, that they can't afford the medications. I know that my insurance at one point denied my asthma inhalers, and I had to pay out of pocket for those. And for me, that's what I really struggle with, is that I can see why so many people are not surviving. And
what your story, people are relating. I mean, people are making comments basically saying that was my experience too. Because what happens is you hear people saying that they're asymptomatic. And I think what that means is that for some people that you're not in the hospital, but you're still having symptoms that you might not be able to identify. So Dr. Cullen, how rare or how common is Gloria's story where you have it and then you still have symptoms that linger weeks, months after the initial positive test?
Yeah, first, Gloria, thank you so much for your willingness to share what happened to you.
So important.
I do, right? It's really important that people realize this is not the flu. And not only is it not the flu in terms of the death rate, but it's not the flu in terms of
Can you move your mic up a little bit, Dr. Cullen, or because it's hard? There, perfect. Yeah, thanks.
Okay, good. So, so Gloria's story, the initial part of it's pretty typical. People get sick, they think they just have a little cold, maybe they had a little sniffle, and then you went into this spiral, which is the thing that scares us the most about this disease. So we estimate that somewhere around 10% of people are what are now called long haulers. Gloria is a long hauler. She has done this for months on end, and she still is suffering consequences. Remember, COVID-19 has a large inflammatory component to it. So a lot of what Gloria is describing is related to the activation of the inflammatory response in her body, and her body saying, I'm going to keep you on this really high level. I'm going to make you tired. I'm going to do all these things. I'm going to potentially hurt your kidney. I'm going to give you headaches. I'm going to give you fatigue, and you're going to work through this. That what we don't know is what happens to these long haulers, right? We've only had this, it hasn't even been a year. So there's lots of what we call cohorts, groups of people, like Gloria talked about. How, remember, Gloria, you talked about how you found groups on the online that you could work with, and that's what people are hoping for. That through the aggregation of people and us following them over what I hate to say, but is what's probably years, we'll be able to see the long term. It doesn't mean that a certain segment of the population just gets a sniffle, because they do. There are people that only get a sniffle or say they don't get anything. We think everybody gets something, but they might not recognize it. They might recognize that I had a headache. It was 2 hours. But Gloria's story should be concerning to everyone. And really, thank you so much for your willingness to share that.
Thank you.
I am, and I think that what you say about the importance of appreciating that we have a network, like we have insurance, we have jobs, we have people that were looking out for us and offering, you know, do you need me to take food? Do you need me to do these things? And my concern is the people that don't have that network of, you know, or somewhere else to go and isolate. And so where can people turn, Dr. Cullen or Gloria, when, you know, they get that call from the Pima County Health Department, or they get that positive test and know they have to go somewhere? Where can they go for help from the county?
So I'll respond from the county, and then I'd love to hear Gloria's perspective from the community. So from the county, what happens is our case investigators and or our contact tracers do care resource coordination. So if you are and Gloria, thank you so much for reminding us. In June, testing was not available. Your experience is very typical. So I'm going to talk about what it's like now, not what it was like 6 months ago, because there were lots of problems. But now there's care coordination, care resource coordination. We do that. Chicanos por la Casa is helping us do part of that in the county through some work with the state, as well as IRC, the International Rescue Committee, as well as our staff, our REACH staff, which is our racial equity staff. People run through a series of questions and ask people what they need to have access to. Now, it is clear that we cannot meet everyone's needs, especially if they're related to fiscal resources, but we do try to get people in touch with and provide them what they need to have.
Yeah. And so one of the resources that was helpful that I've heard about is 211. Like instead of 911, calling 211, and they have, you know, it really, I think, created for mental health services, but now there are other, you know, if you have emergency housing needs or food, rental assistance, that kind of thing. 211 is something that I've heard is working. Gloria, do you know of anything else that we can share with people?
Great, definitely. You know, the contact tracers with Pima County definitely were a major lifeline. While I can't reiterate my privilege that I had a network of support, and I was able to get care. You know, I couldn't stop asking the questions when they called. Like, okay, well, I'm okay, but what if someone needs food? I wanted to know, what do you know? Do you have the right resources to send other people? So I know that they are very well trained and very well versed in connecting people with food, connecting them with resources. And, you know, the bigger things like they need, like you've mentioned, are the financial resources. You know, that's something that they just can't do. Giving them a safe place to quarantine, that's something that they can't do. But they were very vital in providing excellent knowledge in how to quarantine within your house, how to keep journals, how to keep track of your symptoms, how to get resources. And, you know, we've been really fortunate in South Tucson that we've always been surrounded by great people that always want to help. So there's some great organizations that are willing to deliver food to people. And, you know, we also started a small network of these people that are, you know, like me, that are no longer positive, but, you know, we've gone through the antibody testing, and we know that we have a certain amount of antibodies, which I only trust a little bit, but but I know that I can also go and I can go visit someone who may be experiencing that, and I can go drop them off because the likelihood of me getting reinfected is really low. And I don't say foolproof, I say low.
Right.
Because I know that even though I have this immunity, I feel that my body's defense system is really low. I just feel that my body can't even handle a sneeze. I mean, maybe I can fight off the virus, but I don't know if I can handle a regular cold or a stomach bug that's going out there, just because my body's still trying to fight off these other issues that are going on. But definitely, Pima County's done an excellent job with the contact tracers.
Yeah. We had a question from Paul Lovelace. With the numbers so high and hospitals at capacity, do you think employers should do everything possible to allow employees who can work remotely to do so? I would say yes. I'm going to go with yes. I was concerned that with depending on what your job is, some people are not able to, and I understand that from Tucson Unified. There, people that are working food service or custodial staff. I mean, unfortunately, it tends to be the people that make the least in organizations that are the ones that are the frontline people that you need there to, clean and disinfect and do things. But are we doing everything we can as a community, not just Pima County or the city, but as a community to encourage people to stay home and really reduce the numbers that are inside, office buildings?
Well, I wholeheartedly agree. I think employers should be doing more. I think we need to look at systematic ways that we can reduce services, especially when it comes to the south and the west side of town, because we know that makes up the bulk of our essential workers that have been the ones keeping this economy and this community going by keeping those supermarkets open, hospitals open, all of that. And they are the ones that aren't getting that time off, and they're the ones that are coming back to our community. But for me, my biggest concern is really, how are we going to support all of these families? And I know I mentioned I'm maybe a percentage of those long haulers, but I'm also concerned, does Pima County, have you started looking at that infrastructure of how are we going to treat all of these people? In a meeting I had last week with Supervisor Villegas, she mentioned she's comparing this to the TCE contamination, where we needed to have clinics on the south side. Do we need to start looking and creating that system so that we can start treating families and especially on the south and the west side of town?
Yeah.
So let me respond to that. So we are working with the university. There is a long-term study going on with them related to people that are positive, and it has two components. One is first responders, including healthcare workers that are positive. And the reason for that is that it was really pretty easy to enroll those people and be able to do multiple tests throughout and follow them. And then we are working with them to ensure that there is a way to at least evaluate the data. The data right now is the problem, right? Like it's all over, and Pima County isn't, to be frank, it's not like we're collecting a lot of that data from long term. So I think that that's a great suggestion, and I'll take it back from this call to figure out what we should be putting in place so that we can do some long-term follow-up. There's no reason to think, I hate to say this, but there's no reason to think that the long haulers aren't going to have at least some kind of consequence for at least a longer period of time.
Yeah.
So it is important that we pay attention.
And so I tested positive on Wednesday. I've been testing every 2 days, like every 2 or 3 days about. And so I tested last Monday, it was negative. Last Thursday was negative. This Monday, the 7th, was negative, and then the 9th was positive. And so I was able to quickly isolate. I received a call from the Pima County Health Department before I received the information from labs. But I'm right now, it's one of those things where I think the fear of, oh my gosh, what's coming, that I'm, not sleeping well, all of those things that happen. And then you have to worry about, who did I expose? And so I appreciate that I have a place that I can go, that no one else is here, and I'm able to safely kind of stay away from people. But how long should someone like me it was identified on Wednesday, how long should I stay isolated? What does it mean to you to be isolated? Because I know some people are like, I stayed in my room, we share the same bathroom. I mean, that's not isolated. So just to kind of go over some of those things for people who might be in a similar situation, or, have to maybe mentally prepare for if that, they are testing positive.
Yeah, I'd love to do that. I also want to explain the difference now with quarantine. So isolate, you're positive. That's when you isolate. 10 days. We would work with you, Adelita, and figure out when your symptoms started. Sounds like maybe you didn't even have symptoms. So 10 days from your test date. Isolation truly means isolation. It means you're in a room, you're not sharing things with anybody. If you can do that, and that as was talked about, that's really difficult to do. It's pretty presumptuous on our part that people are going to be able to do that, especially if they live in a household. So we know it can't always be done. So if it can't be done, wear masks, wash your hands, stay away from other people as much as you can. Do not use anything that other people are using. Glasses, dishes, toothbrushes, anything like that. Ideally, you really do make a little cocoon around yourself and you take care of yourself. And then for people that are your contacts, which would be, say you live in a household, you've tested positive. Now, everyone in that, if you're living in a household, the assumption is that they're all your contacts. They need to quarantine, and now it's for 14 days. For 7 days. It used to be 14 days. We've actually dropped that to 7 days, assuming that you can test. You need to be able to test on day 5. So your contacts are people that you had been around up till and including the day you got your test back, because you didn't know you were a case, right? So you were probably doing whatever you were normally doing, which is what everybody does. So then for 7 days, those people need to quarantine. Quarantining is just like isolation. It just has a different word to it because they're not sick. So they're quarantining. They're separating themselves from everybody else. That is the only way. I just need to be really frank on it. It's the only way we are going to stop this pandemic. Today we had over 1,200 cases reported again. That Pima County Health Department cannot stop this. People in the community have to be willing and hopefully able. And I don't want to minimize, because we know that there are certain cases where this cannot happen.
Right. And so what are some of the things that people should be taking? I know when my father had it, I looked up, did all this research on vitamins, and it was zinc, vitamin C, D3. And these are things that people were recommending, like just to build up, like just, make sure you take vitamin C. What are some other things that people can be doing now? Just kind of just trying to get themselves prepared. And the sad thing is so many people have it. I didn't change any of my behavior. I've been wearing gloves and having double masks and, minimizing doing things. And I didn't change any of that. And I still got it. And so my thought is it's just, there's more people positive and, it's around more, but what are some other things that we all can be doing?
Yeah. So let me just comment on that. We've been really struggling with why we're seeing this increase, because lots of the community is doing everything right. But what we know is, you've probably heard that concept of super spreader events. So what I think is, there's not really super spreader events. There's individuals that have a high viral load. So they are sicker with the disease than others. And Gloria, you may have been one of those, given how you were describing how sick you got. And we believe that people that have a higher viral load are more likely to spread it. And remember, it's respiratory. Just all you need is a mask that doesn't fit exactly right, or you take it off to drink something around somebody and they've been in the air you're in. Now you get it. In terms of what to do, that is such a great question. And just this morning, I re-looked at new guidance. There's not a lot of guidance. You basically said all of it. Zinc, vitamin C. Some people say vitamin D. What we know is Tylenol or Motrin. Lots of rest. And the other thing is, I want to remind people, the emergency rooms are full. But if you are sick and you cannot breathe, it is hard for you to speak a sentence. So you can speak, but the most you can speak is 2 words before you
Mhm.
feel like you have to take a deep breath. Or while you're breathing, your chest is sucking in because you can't get your air. Please, please get care in the emergency room or the urgent care, or call your doctor and get evaluated.
Yeah.
And in addition to Dr. Cullen's advice, I also really want to touch on the mental health portion of it. You know, for me, initially, I thought the guilt is going to kill me before this virus, because the thought of infecting so many people, it was scary. It was a scary thing to live with. And I know that I was fortunate that those that were in my vicinity didn't get it, but I know that there were others that have, that they've infected their family members, their parents, their people that they love. I think that mental health aspect is so important. One of the other symptoms that I had experience with, you know, I didn't want to post it on Facebook. I didn't want to share it on social media because my family was still reeling from a loss, that I didn't want them to be worried. I didn't want them to be scared. And I also didn't want them texting me because I was so tired and I couldn't respond to everybody. And I would feel guilty about that. So I wanted to just deal with it myself, you know, and I think that attitude didn't help. It didn't work for me, because at one point I recall suffering a really horrible panic attack where, you know, I had never had one in my whole life, and I thought, oh my God, I'm having a heart attack. And it turns out, no, it's a panic attack. This is what you're going through because of the stress. So I really do think that opening up, sharing more, talking about it, creating a system, not feeling guilty, understanding. You know, I was really lucky that my family was really good at reassuring me that, like, if you got us sick, it's okay. You didn't mean to. And those were words I needed to hear. I needed to hear, because it was literally killing me on the inside. So
The guilt is horrible. It really
it's
is.
a big deal, you know.
Yeah. So what are some things that we can do as a community besides masking, having conversations like this? I think really encouraging other people to talk about this stuff is important, because I think so many people think, well, it's because you were unsafe. Well, it's because you did X, Y, and Z. It's like, I could have gone to Walgreens for a necessary medical, supply or medicine or whatever, and caught it there. And the scary thing is that, you hear about so many people having it. And honestly, if I wasn't testing on a regular basis, just because I do have to go into work, I am I've had to work this entire time. We got through a whole campaign. No one ever got sick. And then the irony is that both Andres and I, right after the campaign, I'm like, we're around less people than we used to be. So what is going on here? But I think that's the worry, is like, so what else can we do besides the things that we're doing now to keep ourselves safe, and wear masks that fit really well, wash our hands really well? What I was hearing from you is, Dr. Cullen, and other press conferences, is like, try to just stay home, like get out of the roads. And the sad part is anytime I've gone out, it's, other than occasional people wearing masks under their nose and stuff, it doesn't look like a lot of behaviors have changed.
Right. It's really at this point, we talk about our toolbox, or the tool, I call it my tool bag. I don't have a toolbox, but the tool bag's pretty limited, right? Wear, wash, wait. I did want to tell people that last wait, I did a veteran webinar last week, and one of the veterans said it's really wingspan. So put your arms out and see how far they go. That's how far you need to be apart from people. But it really is staying home at this point. We really are encouraging everyone who can stay home to stay home, to not go out for anything except essentials. If you are over 65 and or at high risk, you definitely should try to use other resources to bring you in what you need to get. And Adelita, I think it's because it's ubiquitous. It is everywhere out there. I just had a discussion with someone earlier today about what happened with them. And I said, you could do everything right. You could do everything right, and you can still contact this virus right now. Because remember, it's in the air. All you have to do is take a mask out for a second. All you have to do is go to a public restroom, right? So you just, people just need to stay home as much as they are able. And, our responsibility, I think, as the county is to make sure we educate people, that we hopefully can help ensure they have the resources.
Yeah. Well, I'm so happy my soon-to-be colleague, Supervisor-elect Dr. Matt Hines, is able to join us. I know he's really busy, but he has been an attending physician at TMC since 2003, and oh, we had a connection, so he'll come back. But and then he's treating patients with a range of diagnoses, from heart attacks, head trauma, chronic conditions, but he's also really has a lot of information about COVID. And so I'm hoping that this is him again, and that he can talk about what it's like for a frontline person. Hello, Matt. How are you? Can you hear me okay? Oh,
Hi there. Thanks.
oh, almost. He'll come back. This is why we try to have a dry run early. It doesn't always work out that way. But he's working, so it is what it is. Hello, sir. How are you? Can you hear me okay?
Is it working now?
Well, I can hear you. It's not necessarily connecting with your mouth, but that's okay. As long as you get the information out there. So can you talk to us a little bit? Thank you for coming and chatting with us. We're really talking about COVID in our community, and I'm joined by Dr. Cullen and Gloria Almaz Lopez, and we're just for you to have an opportunity to share what your experiences are as a frontline worker. Like, what are you seeing every day?
Sure, and I appreciate the opportunity. It's really in the emergency department where I admit patients to the hospital. It's packed. There's a lot more respiratory cases, these types of viral illnesses, or likely COVID, coming in than we would normally see, even though this is starting to get into our flu season. So a lot of folks that are very, very sick, and a lot of people taking up ICU beds, many of them, in fact, most of them from COVID-19. And to explain a little bit about why the hospitals are having trouble and why they start to get filled up, it's because, for an example, if you have an open heart surgery, you're in the hospital and ICU for maybe 4 or 5 days. But a lot of patients with COVID-19 need to be there 18, 20, 21 days or more. And so if you think about that, there's just limited spaces to put people, and when you have that many of those critical care beds getting occupied for so many days and weeks, it's hard to find room for heart attacks or for severe strokes or for, in the case of the Banner system, traumatic injuries from a car accident. So that's why the hospitals have been, talking a lot, almost like crying out at this point, that we're really, things are really packed, and we need to do what we can. As I know, heard from Dr. Cullen, everything we can do: stay away, don't travel from each other, don't travel, put on masks, and non-cohorted families should not get together. Meaning, if you're already staying with, your spouse, kid, that's fine, but you shouldn't merge that group with, say, a neighbor who has 4 or 5 members of their family if you're not already in contact with them on a regular basis, because those little meetings actually spread COVID a lot.
Yeah. So what we saw, I know that Gloria and I were talking about it before we started. What we saw at Thanksgiving is that a lot of the behavior stayed very similar. We saw a lot of cars driving up to people's homes, a lot of people coming in and basically having Thanksgiving kind of as usual. And so for families that really are insisting of getting together, what are some safe things that they can do if the goal is we want to spend Christmas together? What, aside from not doing it, what are some guidelines that we can give people?
I think just whatever to do, you're getting together as a family, some other family there you don't normally live with, which again, not a good idea. Do it outside. Stay outside. Masks, as much social distancing as possible, but absolutely stay outside for everything. Nobody should be inside. All try to avoid the use of public bathroom. That's not great. And we saw a lot of travel in November. I mean, in the Thanksgiving holiday, the TSA reported the highest number of people traveling through the airports that we've seen since March. So I suspect we may end a similar situation, like you're saying, maybe for the Christmas season later this year, and then we'll end up with a surge with the Thanksgiving holiday surge. We're just now starting to see those patients, plus potentially a Christmas holiday travel surge 2 to 3 weeks after the first of the year. So it's not a good time for the hospitals over the next couple of months, which is really bad for the community, because then we're not.
Thank you. So, Dr. Cullen, what kind of support does the Pima County Health Department need right now in order to effectively respond to COVID, guidelines, and trying to encourage employers to have more people working from home? What are some things? I mean, I know Tucson Unified is not going to reopen schools because of, we appreciate that recommendation as well. So what are some things that we can do?
I think there's a few things that people can do. The one is stay at home. If you have any opportunity to stay at home, stay at home. If you are going to socially gather, and I keep reminding people, we're humans and people want social interaction and social contact. So this isn't to demean people that want that, but it's to remind them it is not safe right now. Even if you are okay, your grandma may not be okay, or your father or your mother. So if you are going to go anywhere, make sure you have a mask, and a mask over your nose and your mouth, and Matt knows this really well. But don't use a bandana. Make sure you have a mask that covers your mouth and nose. Stay home. And then the other thing is, you may be aware, last Friday, we put in place guidance for businesses to tell us if they have a case. And the reason why we want to know that is not because we are going to report it to anybody. It's because we want to assist businesses. We want to be able to come in and say, let us look at what you're doing. Let us see if there's ways we can help you mitigate the spread in your business. So if you are an employee and you're working for a business, we would actually recommend that business just get a hold of us. We don't share that information with anybody, but it's really so that we can do education and do appropriate intervention. What we know is that most of the time, when people know what to do and they have the option to do it, which is not always the case for everyone, but they will choose to do the right thing.
Yeah. So I know that Matt and I both represent, we're going to supervisor elects for District 2 and 5, which are the two districts that are hardest hit, I think, based on the census data. So what is it that we can do to support the Pima County Health Department in setting more guidelines? Because you're looking around the country and even around other counties, there's some other counties that are enforcing some pretty strict guidelines that we haven't. And, the same with the state of Arizona, we haven't done some things that other states are doing. So what is it, if you could wave a magic wand, what are some things that we could do as a community to really just shut things down?
Yeah, I think, we've tried to do a lot of things in the past couple of weeks. One was, you'll remember, we put in a voluntary curfew from 10 at night till 5 in the morning. The mayor followed with a non-voluntary curfew from 10 to 5 for the city. So if organizations and businesses and even households would know that please don't be out between 10 and 5, that would be really helpful. We also know that there are certain social situations that put people more at risk for transmission, situations where there is drinking or increasing social mobility within a group of people. So those are the kind of things we would ask that people also try to avoid. But within the public health advisory, we've listed about 5 different things that listed 5 different things that we wanted people to abide by. And the other thing we've been trying to do, and I think it is really important, ideally what we want is people to make the right decision themselves, right? It's not an enforcement. It's that because they know the impact of their activity, they will choose to make the right thing. So this overall, you will recall with the university, we did a voluntary shelter in place, and we literally stopped that accelerated the voluntary shelter in place. We need people to not move, to stay home.
Yeah, and so one of the questions, thank you, Dr. Cullen. One of the questions that Richard had is, can you eat food prepared by others?
Yeah, there shouldn't be any, especially with the issue is how do you get that food, right? If you're talking about a family member, you got to get that food in a way that doesn't create a social situation for you. But we know the Salvation Army on Thanksgiving, we actually worked with them closely and approved the distribution of dinners that they did through a walkthrough or a drive-through situation. That was prepared by the Salvation Army. We felt very comfortable with what they did. We expect to see a similar situation around Christmas. So food prepared by others in and of itself shouldn't be a concern.
Okay. Thank you.
Right,
so
I think like that also about, the need for that self-responsibility to mask up during the holiday season. I think it's so critical for people to really understand that you're probably more likely to get it from somebody you love than from a complete stranger or at the supermarket, because, you come home, you lock your door, you think you're safe, and you rip off that mask. And for us, our contract tracing led us to, my husband, he got it from his mom. He thought mom's never going to hurt me. I'm not going to get it. And mom got it from her other son who was working and was around a lot of people that were not complying with their masks. So I think it's really critical to understand that and to recognize that comfort level that we have, or where we think, I wouldn't give it to them. They wouldn't give it to me. This isn't a choice. It happens. And It happens when you take off that mask. And I know that people are really experiencing this COVID fatigue, and especially for the Mexican culture, these are sacred times. This is when, like, today is Dia de las Virgencita, and we traditionally would be in church, and we're making tamales, and we want to be around our family, and these are holy obligation days. And when it comes also to just your responsibility, you have to wear a mask, especially around your family. But I also, want to put a call out there to some of the churches that are still open at this time. We know that these are holy days. We know that there's obligations, but it frightens me when I drive around and I see churches that are allowing people to come into their facility, that are still holding mass. And it scares me when I think of, the priests locally that have already contracted this virus. If I also look at some of these very well-intentioned, generous people that want to do toy drives for kids, that want to support our families that are in need, and they need it. I get it, they need it, but they're not changing the way that they do it. Frightens me the fact that you're going to have a toy drive and kids are going to come in, and they're low income, and I always go back to that privilege I had where I was able to survive, and I know that others don't have that. So it's still a lot more education that we need to do for our community.
I agree. And I think that outreach in Spanish and other languages, our refugee communities are also experienced. I mean, I pass by a lot of churches of different nationalities and religions, and they're all packed too. So it's not, and one of the things that I keep saying is, when we were growing up, it's a big thing where, like, when you walk into the house, you're like, well, ve saluda a tu nana, ve saluda a todos, give besitos to everyone. And now everyone's like, here's an elbow. Like, I don't think I hugged my dad in months, because it's like, we like do a foot or an elbow, and, but I think that it's awkward and uncomfortable, especially for people who, like, I raised my kids. So, like, you go say hi to everyone, you say bye to everyone. And now we're like, from the door, like, see you guys, we're not even going to walk in the house. But I think that, one of the things that is difficult is trying to think about holidays without your family. The last time my entire family was together was my Nana's funeral. And literally the next week we were all shut down. And so it just was like a tiny window. So we're all trying to deal with loss. And like Gloria, you're talking about it too. the more I look at people like on social media, it's like, there's all these pictures and tributes to people who have passed away because of COVID mostly. And, we can't honor those people. We can't honor our friend Richard Elias. And I just think that makes it very, very difficult because you continue to, there's no opportunity to celebrate a life and no opportunity to mourn together and support each other. So trying to come up with creative ways to do things that are informative, I think is something that we have to continue to do, because otherwise, until everyone has the opportunity to get vaccinated. And Dr. Cullen, maybe you can talk a little bit about that. Like when do we anticipate vaccines being available in Pima County? Who might those go to first? And when, just kind of like testing, like when do we foresee it being something that, the masses can access?
Yeah, so we do expect that we will have vaccines in the community December 17th. That's our hope. Next week, the governor has indicated that a nurse working with him will be the first person in the state to get that kind of immunization. It will be that day, supposedly.
So on the 17th, the nurse will get it. I'm having a hard time hearing you, so that's why I'm clarifying.
Yeah, on the 17th, the nurse in Phoenix will get it. And then we have worked with UMC and TMC. The very first shots will be given to healthcare workers who are high risk, healthcare workers that are working with COVID positive patients. The first series of shots, immunizations we'll get will not be enough to even cover our healthcare workers, but we do anticipate continuing to get immunization availability over the next few months. In terms of general populace availability, most of us, and remember, these are really just speculative, most of us are thinking that will be late spring. And the reason for that is, remember, the only vaccine approved right now is Pfizer. Moderna is supposed to get approved sometime the 17th or the 18th. But until there is more than a few vaccines approved, it will be difficult to have enough vaccination. The other group that's first is long-term care and assisted living because of the mortality. We have seen the death rate in that. So those healthcare workers working with COVID, and then healthcare workers in general, including pre-hospital, EMS, and then long-term care workers will be the first ones to have access.
Do you foresee any more pop-up sites in specifically like South Tucson, West and South Side? Because I think one of the things preventing people from registering is the whole online process. For some people, they just don't have access. And so when we have the pop-up sites where people can actually assemble, even if they stand in a super long line, like I know, I think that would be really helpful, specifically for the communities that, Gloria and I live in, that it's important for us to be able to give people an easier way to get tested. Because right now, you open up one of, let's say Keno, for example, and they're, the next date available is Monday or maybe Tuesday, and it's not in a convenient time. Well, that person who really wants to test probably won't because it's not convenient. So any ideas for that?
Yeah, we are continuing to open more and more pop-up sites. On average, we are, what you're saying, Adelita, is so true. When we open a pop-up site, we get 250, 350, 400 people. And so we've extended the hours of some of them. But just on Friday, I talked with Erica Smith, who's helping lead that initiative, and we do expect to see more pop-ups available, especially in the next couple of weeks.
Great. So we only have a couple minutes left. Gloria, is there anything else that you wanted to say or add before we sign off?
Well, just as a parent, I really wanted, to address our parents. We know that our kids have been suffering. We're aware of how isolated they have been. And I know that so many parents feel that they have to overdo this Christmas. You don't have to go out to the store. I can guarantee you, from working with children, the risks of you contracting the virus out there. Kids would rather have a parent alive than have an Xbox. I know that from my experience with my family, they would give anything. They would give their cars, they would give their money back just to have them back in their life. So, we have a vaccine coming. It's around the corner. We're starting to see a light at the end of the tunnel. We realize the COVID fatigue is real. It is real, but hold on, stay safe, mask up.
Thank you, Gloria. We can have Christmas in July.
Perfect.
That's okay. We can do that. Well, I want to thank you both. I want to thank Dr. Matt Hines, who had some connectivity issues and I know was really busy popping in and out of different meetings. Dr. Cullen, I know that you've been very busy trying to be everywhere at all times, so I very much appreciate it. And Gloria, thank you so much for your bravery and telling your story and really being such a strong advocate for our community. South Tucson is very lucky to have you. I want to thank all of you who joined us and those of you who might watch this later. I'm very appreciative of your time. Thank you so much. And yes, Richard, we will do more things in Spanish porque es muy importante tener estas pláticas en español también. Thank you very much. Stay safe, everyone. Mask up. Thank you.